There have been plenty of criticisms levied at various levels of government around the responses to the COVID-19 pandemic. Some of that criticism coming, as you might expect, from the official opposition. Michelle Rempel Garner is the health critic for the Conservative Party of Canada. She joins us now. Thank you very much for being with us, Michelle. And I want to start with, I guess we all agree that it's much easier to criticize others than actually be in there doing it. But when you look at how this has unfolded, and with the passage of time, right, we've had months and months now of a pandemic. What do you focus on in terms of what you would do differently as a party than what the federal government has done?
Rapid testing keeps things open. That's a mantra that I think the government needs to embrace and explain why Canada does not have access to widespread access to rapid testing. This technology in and of itself would allow for certainty across many different industries, be it the restaurant industry, the airline industry, being able to have a better way of keeping things open rather than looking at a 14-day quarantine when other countries around the world are doing this is just something that the government has to respond to. So this is why this has been the focus of our parties since the Parliament resumed after prorogation, and it's something that we are definitely going to keep the pressure on as we move forward.
And when you raise the issue and again keep the pressure on, as you say, what kind of answers do you get? Because there certainly hasn't seemed to be much forthcoming into why we haven't done better, or at least as well as other countries on the rapid testing front, and even, frankly, the testing itself. The backlog of testing and the turnaround times aren't very good here.
Agreed. This is an issue I've been pressing the health minister on for over a month now. We've gotten no answers. I did raise a procedural motion in the House of Commons Standing Committee on Health. The Liberals have been filibustering that motion. So we are looking at other ways to force this issue. And to me, this is not really a partisan political issue in any way, shape, or form. Every industry, every person in Canada needs these answers. We need a better plan so that we're not just looking at prolonged economic shutdown, isolation, families separated, businesses being lost, given that we don't know when a vaccine is going to come, if it ever is going to come. So, what you said is perfect. The government has had months to look at best practice around the world to come up with alternative strategies outside of simple economic shutdown. And they need to explain to the Canadian public why this hasn't happened and how they're going to rectify this situation. That's the job of the official opposition right now, is to ensure that those answers are forthcoming.
Do you also have a view, and I guess in a minority parliament, we have to recognize that at any time this could, of course, be a campaign view, but do you have a view of the balance between safeguarding health and keeping the economy open, and where do you think the government's coming down on that?
I don't think those are two mutually exclusive issues. There's best practice around the world that shows when you do have access to frequent rapid testing, you have better public health outcomes because people aren't saying, you know what, I don't want to wait in line for 3 days for a test and then self-isolate for 10 days while I wait for a result. The frequency in testing, the best practice that we're seeing that comes with rapid testing allows things to stay open. So and also allows us to detect and quickly contact trace. So I don't see it as a dichotomy. I actually see it as a way to keep the economy open and have better public health outcomes. Contact tracing doesn't work if we don't have access to tests, right? So, and that's what we're seeing as cities like Toronto, like Ottawa are saying, you know what, we actually can't contact trace right now. So I actually think that this is probably the number one emergent issue in any level of government right now. And, the federal government has just been dragging their heels on this. They're not forthcoming with when approvals are going to happen for certain technologies or when we're going to receive these tests. And we're going to be pushing for that very hard in the next few weeks.
Yep. All right, we'll leave it there. Unfortunately, we're out of time. Michelle, we do appreciate your time today. Michelle Rempel Garner is the Conservative Party health critic.